1974 was an eventful year. Harold Wilson entered number 10 as the Prime Minister for the second time. Tiger Feet by Mud spent 4 weeks at the top of the charts. And perhaps most importantly, the West Suffolk Hospital opened. Many of the staff moved across from the old hospital in Bury, which was built in 1826, and stepping across the threshold of the West Suffolk in 1974 felt like stepping into the future of healthcare.
So one of the things I do remember were things that were covered in plastic, including the sink and the trolleys and new equipment. And it was like opening Christmas presents because, this is special for us.
There's been a lot of change over the years, and our colleagues have many memories of the way things were.
I think probably one of the biggest changes has been the electronic system. I think we can all remember when we first got computers in the trust, and we were just kind of registering patients then, but now obviously all the documentation is electronic. That's been a massive change.
The Naunton estate was being constructed at the same time, and there was also at that time GLC movement. I mean, I came up with my parents from London and finished my schooling in Bury, but Naunton estate especially, and the community centre, a lot of the houses the hospital owned. And it wasn't just nurses or doctors, it was also support staff who were put in those. So a lot of the people also, strange it be, who were on the construction, a lot of those different people came from out of the area. And because the job was 3-4 years, well, probably even longer when it's from the start, they actually bought houses and have stayed here.
We used to have a manual board where we had to put up all the names of all the appointments for the afternoon. Before we left, we had to take down the morning list, put up and that was quite a performance.
When I was a student nurse, patients could smoke in bed on the orthopaedic wards. One of the jobs of a student nurse was to make sure that the ashtrays were emptied.
I've been here for the last 14 years as a consultant in the emergency department. Ever since I've joined here, ever since the hospital has been here, we have been training doctors, and the most importantly, training the nurses as well. I'm very proud to work in this hospital, and our working conditions are so good here. They're a friendly hospital, and everybody talks so good about Bury St Edmunds.
So in the 36 years I've been here, the menu's progressed, but generally patients-wise, the foods have sort of stayed the same. They still love their cottage pies, fish pies. Roast dinner days are still a favourite. So, we make all our own homemade soups, which go down very well.
The West Suffolk Hospital has become a diverse community, enriching our patient care.
Over the last 50 years, international colleagues have been beneficial in shaping up the services of our hospital. Their continued presence here has brought in varied experiences and varied perspective so that we can always deliver the best services to our patients regardless of their identity.
Nothing good ever stays the same, and we too keep moving forward, with new beginnings and fresh stories to tell.
My name's Kate Turner. I've been working within the Trust for 50 years now and still counting.
I've been working in the Trust nearly 40 years now.
I've been working for the NHS for 24 years and I'm still counting.
I've been working here 23 years. There's been a lot of challenges, but it's been a blast.
I'm Will. I've been working for the Trust for 8 years now.
My name's Rachel. I'm an F3 and I've been here for 2 years.
I've been working here just over 2 years. It feels like a real community and I could see myself working here well into the future.
I'm the clinical lead physiotherapist for intensive care and surgery. I've been working at the Trust for 8 months.
We are T-level students at West Suffolk College studying health and social sciences.
And we are both looking for a future career at this hospital.
Yeah.